coming to one very important topic about von Willebrand disease. So which of the following statements about von Willebrand disease is incorrect? It's asking incorrect. Okay, so let's delve into some important details. So it can be classified into type 1, type 2 and type 3. So it's a most common inherited bleeding abnormality, and von Willebrand factor is secreted by Weeble palette bodies of the endothelial cells and alpha granules of the platelets. Okay, so type 1 is characterized by mild reduction in von Willebrand factor and it is inherited as autosomal dominant. Look at this. Type 3 is severe reduction in von Willebrand factor and it is inherited autosomal recessive. So type 1 is dominant, type 3 is autosomal recessive, and type 2 loss of high molecular weight multimers and it is inherited in autosomal dominant. So von Willebrand is either due to reduced quantity of von Willebrand factor or dysfunctional von Willebrand factor. So reduced quantity, it is type 1 or type 3. Dysfunctional is type 2. Okay, so mild reduction is type 1, severe reduction is type 3. So type 1 von Willebrand disease is most common and type 3 von Willebrand disease is most severe. Okay, so again, von Willebrand factor is either due to decreased levels or dysfunctional von Willebrand factor. Most of them are due to autosomal dominant. Most of them follow autosomal dominant pattern of inheritance except type 3, which follows autosomal recessive. So look at the pathophysiology. Von Willebrand factor is needed for platelet adhesion and aggregation and acts as a carrier for factor 8, extending its half-life in circulation. So thus, von Willebrand affects both primary and secondary hemostasis. Okay, so it affects both primary and secondary hemostasis. Okay, so what are the frequent presenting features? Frequent nosebleeds, oral mucosal bleeds, GI bleeding, heavy menstrual cycles, easy bruising, and prolonged bleeding after surgery or trauma. Okay. So in von Willebrand disease, you, as a result of underlying pathophysiology, you have defects in platelet adhesion as well as decreased levels of factor 8. Okay, so lab findings include bleeding time is prolonged, platelet count and prothrombin time are normal, APTT is prolonged, and the diagnostic of von Willebrand disease is restositin cofactor assay. Okay, so the treatment includes DDAVP, that is desmopressin, then OCP pills only in menorrhagia. Important thing, avoid aspirin. Okay, so desmopressin is not effective in type 3. So look at these two important points. So type 3 is inherited in autosomal recessive fashion and desmopressin is not effective in type 3. Okay, in acute state, you can give von Willebrand factor concentrate or even along cryoprecipitate. So cryoprecipitate contains fibrinogen, factor 8 and von Willebrand factor. Okay. So remember, type 1 is most common, type 3 is most severe. So which of the following about von Willebrand disease is incorrect? Okay. So type 3 is most severe in children. We just saw it is correct. Type 1 is usually severe disease in children. No, it is a mild disease. Type 3 is characterized by severely low levels. Yes, this is correct. Type 2 is more related to activity than levels. Yeah, we saw type 2 is dysfunctional. So this is correct. So the answer is A. Okay. Hope this is clear for you. Okay. So von Willebrand disease, very important and very frequently asked question.
To watch the full video, download our app on App Store and Play Store.